A quick favor before we start, if you love the Blueprint podcast, please rate and review us wherever you listen. It makes a huge difference. Thanks and enjoy the episode. Welcome to the Blueprint podcast, where we throw out the old blueprint so you can become who you were always meant to be. I'm your host, Jason Smith, and if you haven't already, make sure you click the subscribe button and share this podcast with your friends on social media and tag me in it at JBirdFit. Today, I have a very special guest for you, Dr. Tommy Rhee. Dr. Rhee is the founder and CEO of Regen, the first company to develop a cell-free topical regenerative technology designed to support healing without injections. Dr. Rhee has spent nearly 2 decades as a sports chiropractor working with athletes at UCLA, the Tampa Bay Buccaneers, and beyond. And he's also served as a U.S. Navy Aviator. His groundbreaking research into topical stem cell applications is detailed in his new book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy. Dr. Tommy Rhee, welcome to the Blueprint Podcast.
Jason, thank you very much for the invitation, and I'm excited about this.
Yeah, this is going to be a lot of fun. You've had a fascinating journey from serving as U.S. Navy Aviator to becoming a sports chiropractor working with elite athletes. Looking back, what experiences shaped the way that you see health and performance today?
That's a great question. Going back, I guess like everybody else it's in the sports world, you started as a small child playing sports, playing all the sports, and figuring out that if you really enjoy that competition and push yourself and seeing what type of goals you can set with just your body, the winning, the achievements, and then from there, it just evolved into seeing how you can push yourself. And if it's from the military world or working out or playing a sport, even going into the mental side of it, I really developed something that you can take something you really enjoy, and as you age, you kind of have to slip away from that aggressive physical stuff. But then you start thinking, I still want to be in that arena, and then you start becoming that assistant, that coach, that provider, that doctor. And then that's how it evolved into becoming a sports chiropractor. Because I always see myself like, I know what the athlete's thinking, because I used to be that kind of athlete. And then you start thinking, so with that athlete and their physical problems, you start thinking like, all right, how do I get them back to peak performance? So you understand their mental side of things, and then you move into me being a mechanic and them being a race car. I'm trying to get them back on the track at high performance.
That's awesome. So how do you go? It's so interesting to me. How do you go from the Navy into becoming a chiropractor? What was the segue there for you?
I mean, like every child in high school that plays sports, a male, you get into a little bit of the aggressive testosterone strength and power in sports. And so in high school, typical guy that loves playing sports and pushing everything to extreme, you go into the extreme of other things, extracurricular activity. I got myself into, I knew what kind of person I was. I was like the extreme out of the box, pushing the envelope. So that led to staying away from sports and pushing myself into other things. And I got in some trouble, and I knew that my mental side was not ready for college or just growing up yet. So I had a decision back there when I was graduated from high school, made some mistakes, and military was just a perfect fit. It was something that was forced onto me, but it was a forced great decision. So with that kind of personality that I had, I knew that military was a choice for me, especially when you talk about going to extremes, pushing yourself, and not really having, I knew, generally speaking, I knew that I wanted to become something, but to put that drive behind you, that was the missing link. And then the military kind of put me in that mind frame of that. Look, there's a time to have a good time, and there's a time to have some discipline. And with that, you push yourself, and the military teaches you how to restrain yourself to go into that bigger thought process of achieving your goals, and you're learning how to focus on what you need to do. So from there, I knew that since going back that we come from family doctors. So my dad was a surgeon, uncles, aunts, all that stuff. So I'm a first generation from overseas. And then I saw what my dad was doing with patients, and I really enjoyed what he was doing. And I have it in me that I love helping people. So I think when you get in the military and you start seeing the world in its wide range, you start understanding, okay, I see what I need to do. And that's why I thought about what felt good to me. And then I just moved forward and went to that route of going into the medical chiropractic side, especially in sports.
And I love that story because so many of us find ourselves in this place where we've made some mistakes and we've struggled throughout our lifetime. And for some people, they never fully grow beyond the mistakes that they've made. But you say that you were forced into the Navy as an option for yourself. But what it gave you was this focus, direction, mental toughness, discipline, and it allowed you to become the person that you are today. So for the people that are listening, I just want them to know that your mistakes don't define you and that you can grow beyond them, but it's a choice that you have to make.
100%. Another thing that I have a great defense mechanism about me is that I have bad memories in the sense that I don't remember bad. I only remember the good. So when I look back, I said, oh, I had a great time, but I have to really think about it. So why did I move out of that world? And I remember, okay, so I think because of the military, they're always teaching you how to live in the future, move forward, just find yourself a goal and look that way. So you're never looking at the past or the present. I know the past is a good history and a good lesson not to repeat, but I really think that the military right now when I see these kids coming up, I see them like lost souls. They just need a little direction. And sometimes when I see that, especially in my world, I'm still practicing, I have a conversation with the kids or the parents and I say, military is the best thing right now. It's the best thing for you guys to find just like a soul search. Sometimes they're just like an idle position. You're just like just going through the motion and trying to figure things out. And that's why you hear about when we were kids, the minute you turn 18, we were out of the house. Now it's like late 20s, 30s, they're getting out of the house because they're kind of lost. The military really sets that future goal, that objective that you want to start looking at, and then you figure out, all right, and they teach you how to get those steps to get those goals. And it's very interesting how the military does that. So if you really open your mind and just embrace it, it's a great experience.
Yeah, it's interesting. A common belief right now or thought process that a lot of people, young people have, is that they have this overwhelming sense of hopelessness, that their future isn't clearly defined. They don't know where they're going, what they're doing, or the why behind why they're doing it. And a lot of things were not coached, mentored, or taught, and they certainly weren't observed in their background. So they find themselves in this place where they're just not fully self-actualized as an individual. They don't see the path forward. And so the military is always an option, but finding that coach, that mentor, that helper, somebody that can help move you forward in life is really something that I believe everybody should be doing. Even at this stage of life, I'm still looking for coaches and people to teach me how to move things forward.
I remember the saying back there that we have these little forks in the road as you go into your life. So I remember I had several forks, some bad routes, some good routes, of course, but I remember this one fork I had a big mouth. I had that kind of mouth like you typically hear about. Got myself in trouble. Even in the military, I got in trouble, but I knew how to talk my way out of it. But then again, you only get so much of that little leeway, right? You always get caught. So I remember this petty officer Montgomery. I was going through what they call training up in Millington, Tennessee. And he looked at me and I was just shooting my mouth out. And he says, that mouth is going to make you or break you. You better pick right now. It gave me an eye-opener of what to do moving forward in that position, because I could have really hurt my career in the military. That I always go back and just see his face and hear right before a big decision or just before I open my mouth and say, hang on, let's do a little bit of countdown before I start answering this question here. So working the roads and mentorship and just finding that person that you want to mimic or become that person. Yeah, absolutely. It's important.
You're no stranger to sports. What did working with athletes at UCLA and the Tampa Bay Buccaneers teach you about the limits of traditional recovery methods?
So UCLA, great experience. It was early in my career as a sports doc here, and I had the luxury of seeing these collegiate athletes like All-American, McDonald's All-American, and these high-caliber collegiate athletes. And you see them, they're still developing. They're still developing into this athlete. The younger you are, the easier it's recover, right? So but once you get to the upperclassmen and you start looking at them as they develop into a professional athlete, move on, you start seeing that it's about the recovery, exactly what you said. So it's about the time that it takes you to basically come back to 100%. So you look at some of the cheating methods and you know how they do the PEDs or some type of enhancement. So you see some of those and you just look at that, you just stay away from that. But then you see what else they can do with nutrition, sleep, and then a lot of things were coming up. So this is back in 2005, and then in the regenerative medicine world, it was a thing called prolotherapy back then, where they used to, if you have an injury, they would inject like a mixture of saline and sugar, dextrox they call it, and then they inject it in the area, and then your body will think it's like an antigen and starts fighting it and creates this excess collagen and fibrous material to heal the tissue faster. That was the idea. And you see that. And then you start thinking about other things like back then, it was rare to hear about what they have now, which is the cryo or the plunge or the cold plunge. Hyperbaric chambers coming around then. And then really it's just a lot of rest. It's almost like the old school. It's almost like it's coming out of the old, remember the old days of when you worked out, it wasn't about hydration. It was just about pushing through. And so hydration was like a form of a reward back then. So now it's a must. So it's evolved a lot. So when you see those collegiate athletes back at, that was 2005, 6, and 7 around there, you see those athletes, they're just developing. So it's not really specific in where you go up to the upper echelon of like when you go Olympians, pro athlete. Now you're looking at like bigger type of modalities, equipment, time. There's a lot of things like those regenerative medicine from prolotherapy that I discussed. Then went to the PRP. Then then went to stem cell. And stem cell is where when it's right now you get the stem cell tissue from what they call the Wharton's jelly of the umbilical cord. And you're chasing this thing called the mesenchymal stem cell. Prior to that, it used to come from your own adipose tissue, your fat, or your bone marrow. Pretty invasive, but they would do that in the off season. The difficulty with that is that when you do regenerative medicine, especially the injectable route, there's always a downtime. So they don't prefer doing regenerative medicine therapy during the season. So when it comes to recovery, it's about off season is when they really push and maximize and get their techniques down. Once they're in season, especially in track, because you're doing one max rep, you're explosively doing something real fast. So you're trying to destroy tissue. So that's where all you're doing is maintaining it. And you're just trying to keep just everything as status quo for the season. It's hard for you to advance because you don't want to break down more muscle tissue from like a workout and then you go run a big event and then you're doing what they call overtraining. So you have to have that right mixture. So off-season football players, collegiate athletes are different because of the year time span. So when I look at like these two groups, college players, they're doing a little bit of different kind of, because they're still young and they can recover faster. But when you go to the professional athletes, now you're looking at an older person that has to have more time. So that off season is very important with stem cell therapy, hyperbaric chamber, something that helps them like recover faster and all the physiology of their bodies. So I hope that answered that question.
No, it does. And what is the viability of using your own stem cells?
Okay, so there's if you're chasing this thing called a mesenchymal stem cell, right? Mesenchymal stem cells is an abundance in both of the bones, your fat tissue, or your bone marrow. The problem is that think about your age. So if you're 40 years old, your cells itself is 40 years old. So that signaling is similar to the signals that you have the damaged tissue. You need something that's very young, vibrant. You need a young signal like the actual umbilical cord from the Wharton's jelly from the childbirth, right? So that signal is very strong, very vibrant. That gives you a better signaling ability to take your existing tissue and turn on and regenerate. So I always think that you look at your own tissue and they say that, yeah, it's got its potential like abundance of cell count and abundance. So yeah, there's some truth to that. But then you look at, does it give you the same amount of signal as something that comes from the umbilical cord that has that younger, vibrant tissue that has the ability to really turn cells on, to generate, like the umbilical cord or the placenta, how fast it grows. So those are the two comparisons you want to look at. So then when I see someone that wants to do stem cell injections that's from their own tissue, I just give them a little education about that tissue's like half-life, its potential like signaling versus something that's young. So that's why I think it's very important to understand those two facts.
So you're looking at different outcomes using the different types of stem cells at that point.
Yeah, signal. Now here's something funny about stem cells in general. People think that these stem cells, these mesenchymal stem cells, they call like pluripotent and multipotent, they think that these stem cells are going to turn into your existing tissue that's damaged, if it's a tendon, ligament, bone, cartilage. But it doesn't really do that. What it does is signals, because the stem cells secrete this thing called EVs, extracellular vesicles. They call it cell-free. It's just a signal molecule that comes from the actual stem cell, mesenchymal stem cells, that signals. It's called a paracrine effect. So it signals cell to cell. And it's just waking up your existing cell to turn on to say, hey, generate. If it's targeting like tenocytes for the tendons, if you're looking at cartilage, you're looking at like chondrocytes, and so on, like satellite cells, muscles. You want to turn those things on. Those cells, because of the age, we start slowing down that process, or they go into a thing called senescence, where you don't have the ability to do like RNA, DNA replication. So because of that strong signal ability from the Wharton's jelly, from the umbilical cord, that's the signal you want that has all those information to turn on your existing tissue.
Hey, Blueprint listeners, if today's conversation resonated with you and you're ready to truly unlock your own personal transformation, I invite you to explore the Self-Discovery Blueprint. This is where we dive deep into the strategies and insights you need to understand who you are, clarify your purpose, and build the life you're truly meant for. It's the comprehensive guide to your next level growth. You can find out more by visiting my Stand store, link in bio, or in the show notes. So it's sending a message to your existing stem cells to wake up and start producing in a way that they had typically produced prior to whatever age you are today.
Yeah. So now, as we're young, we have a lot of these cells. They're very active and they're vibrant. So when you look at a cell, it has a nucleus and a DNA. So they have a thing, a chromosome, but at the end of the chromosomes are a thing called telomeres. Telomeres are basically the safety mechanism. It's just like at the end of a shoestring, you got the plastic the caps. That same thing. So when you do a replication and go through mitosis from like RNA, DNA replication, and you got these things, these little codes called codons. These little messages, right? These little codes will tell you what you're going to mitose, make daughter cells into, if it's tendons, muscle, cartilage, heart, whatever. So these codes are basically just kind of, they have their like mismatch and then they turn into whatever. Now, telomeres, as you do replication, you have so many of these replications. And then they call it the Hayflick limit. So they say it's between 40 to 60 kind of replications. And then their telomeres, as you replicate, shrink down. As you go into a certain height of the telomeres say, all right, stop replicating because we don't want to lose this cap. And all of a sudden you start miscoding and then you get like a tumor formation, right? Something odd to grow. So then these things go in a thing called senescence, like a zombie state. So then you have to ask yourself, it's just sitting dormant, this little adult stem cell, these tenocytes, they're sitting there. So how do you make these things grow? These telomeres to get ready to replicate, make daughter cells? You need an enzyme. So a doctor out in Berkeley founded this little enzyme called telomerase. Telomerase is that enzyme to increase telomeres. So now going back to the donor side of the umbilical cord, the Wharton's jelly, there's a high abundance of that enzyme telomerase in this Wharton's jelly. So that's what's important. Now it's really two signals. That's how I look at it. So you have to get, first, the signal you want to do is get the telomeres out of senescence, right? And then you want to get that cell in its normal, out of a dormant state into a normal sitting still, ready for a signal. Then the next thing is you want a signal. If it's transforming growth factor beta, if it's interleukin 10, you want that signal to go down there and then from the Wharton's jelly and what they call the extracellular vesicle, and then wake up that cell. So it's like that 1-2 punch. You have to first get it out of senescence, and then now here comes the signal to actually turn on and generate. So that's the really important thing, is that just to have those two is, the step process to really understand to generate tissue.
So are we getting younger in this process as we try to extend the telomere?
That's the secret, right? Telomeres is the secret for anti-aging or longevity. So absolutely. Now, I'm a musculoskeletal guy because I'm a sports guy. So I look at localized things. There's a delivery mechanism we all know about, injection. And then, of course, there's my product. It's called Regen. It's a topical. It's just basically, it's the same type of information from the donor site, umbilical cord, Wharton's jelly. But a different delivery system. One is injectable, one is a transdermal cream. But the most important thing, it gets into your body.
And your preference there, topical over injection, why is that?
We know injection is an invasive, right? So if it's interarticular, if it's muscle, you have to get invasive. The typical provider will use either some type of guided way of either like a fluoroscopy, like an X-ray that's giving you movement, or maybe an ultrasound guided needle. The thing is that if you're doing a blind injection, you're just going through tissue to get to the damaged tissue, right? You have a primary injury, and then you got a secondary injury from the injection. So that secondary injury is prone to infection or compromising other tissue. And then the worst thing about this is the reason why they don't do it during the season is because you have downtime. Meaning that they say after injection, don't do nothing for the next week or two because, you have to recover from the secondary injury site from the needle. So then you think about in a sports world, athletes want to continue to play. You don't want to lose a week or two of game because that played havoc on your contract, your money, and then, your future contract. So they don't want to have that scenario. So they typically, they go into the pain med world because if you could not feel anything, then you're not, having fake injury or whatever. So the thing is that now you think about if you can regenerate tissue during your season, so then they can have the ability to keep playing, but then have the therapy of the actual, the EV signaling to grow tissue. That's where the topical component comes in. So now that puts into play this world of using this during your season. So I've got athletes on it in the NFL, and it's doing great with them. It's an interesting world about when you look at professional sports. We can go into all that as far as how athletes look at the medical side of it and how they have to keep themselves in tune and then really be playing chess with their injuries and how the contract is played and how they negotiate because it's a pawn. It's a piece in their puzzle when they renegotiate, right? Because the team may say, you're prone to this injury. Why do I have to pay you this much money? So that's what's playing in their head. So the more they can be injury-free, especially prior to a year or two before the contract ends, the better it looks in their world of renegotiation for the contracts.
Yeah, it's always interesting because you look at books like Life Force by Tony Robbins, where he goes into stem cell therapy and the use of that, the benefits that go along with it. And he talks about a story where his shoulder was injured. They were saying that he has to have shoulder surgery. I went through shoulder surgery not that long ago myself. Do not recommend, not fun. But he talks about the utilization of the stem cell therapy within the shoulder, and it got to the point where he didn't have to have the surgery. So I'm really curious about those type of instances. Is this something that can regenerate the tissue enough that you can mitigate having to have surgery?
Oh, absolutely. Now, we're not talking, so it all depends on what type of diagnosis or injury you have, right? If you have a tear that's a partial tear thickness, and you have, let's say maybe a third to half of the fibers are torn, but you still have the remaining that still allows you to do the action, like a typical rotator cuff injury, right?
Yeah. So I could do the action, but I couldn't lift more than 10 pounds to curl it up towards my chest.
Yeah. So with that, you have to find out with a good diagnostic tool like the MRI. It shows you where you're at. If you have a complete rupture, like it's torn, regenerative medicine is not going to approximate those two tissues together and then let it heal. So you have to have, number one, the tissue have to be close together, right? You have to have an ability to be close to generate because you can't have a tissue that's, when you tear a bicep, your bicep curls up, and then when you do the surgery, you have to retrieve it and pull it back. Basically, just a whole fishing expedition in your shoulder to get that thing back in there. So when it comes to those type of complete ruptures or tears, regenerative medicine is not going to have it recoil back up there. So those are not the candidates. Or if you're having osteoarthritis and you hear a bone-on-bone scenario of a joint like the shoulder or the hip or the knee, there's no tissue to grow. What are you going to grow, right? You have to have something there to grow. So those kind of candidates, we eliminate off the scope of regenerative medicine. But when you look at maybe a partial tear thickness where you're able to do the action, but it has a strain, then you're a candidate. You have the ability. So what you're thinking about is just like if you have a cut in your arm or in your skin, you want to think about, is the tissue proximatable? Is it close to each other? And then, yes, now what you want to do is use regen. Just have it, the topical side of the regenerative medicine stuff, and apply it on there and then utilize that growth of that tissue and then do good rehab. Get your articulation correct. Make sure that whatever started the whole injury process, you corrected that and go back to a good firing pattern. So then you're doing the right type of, in your case, your rotator cuff. You're not anterior gliding the head of the humerus forward. You got to put it back there so the posterior rotator cuff muscles are keeping it into the socket with the glenoid socket. And then just do corrective movements and let the tissue heal in the proper biomechanic movements. So yeah, when it comes to those things, fantastic. Musculoskeletal stuff, it's huge. It's going to be almost like a Band-Aid when you get injured. It's going to be one of those days that you're going to say, all right, go in this protocol and do this to heal faster.
Now, is this something that we would also utilize prior to injury as like an ongoing treatment?
That's what the NFL guys do. When you look at NFL guys, they know that they had a great season, they're trying to recover, and they want to do preventative stuff. Absolutely. You may have 100% of, let's say, the ACL, but wouldn't it be great if you had 100% of good, thick tissue instead of like that, so it coils back up? Because when you play sports, you're elongating things, you're extending things out, those ligaments get pulled and stretched out a little bit.
Shredding them, yeah.
Shredding it, yeah. Anything you can think about in the preventative world, absolutely, it's huge because you're trying to maximize your performance at such a multiple level and during your season that it's very imperative that if you can get your tissue back to its really youthful state, oh, your performance is great. You ever hear about those athletes that have let's say they're out for the season for an ACL injury and they're going for their knee thing, but then when they come back, they do much better once they get the confidence with their knee. They do much better because they had that a season off of really recovering, that real recovery. That's what it is all about, really getting a recovery. So you think about a cheating method how to recover, that's the stem cell. That's the stuff that you want to do. Get those guys that grow those tissues back to those pre-season, pre-injury, that almost like the high school, teenage tissue.
Yeah, I will say it's interesting trying to gain that trust in that limb again, especially after surgery. I found myself in this place where I couldn't raise my arm all the way up and I couldn't do push-ups or pull-ups or anything with it yet. And that was 5 months out after the surgery. And it was okay, at what point can I get to this place where I can begin to really trust this? Because my job depended on me being at a higher physical capability than what I had in the moment.
Did you go to rehab like PT?
Oh, yeah.
Okay. Yeah.
Yep.
So
I had a competing neck injury, and so that created a bunch of triggers down my lat up into my armpit, and it was just constant triggers. We were always doing dry needling and different things, and I could only raise my arm up to here, and we couldn't get it all the way up past my head.
Yeah. So when what type of when you had a rotator cuff surgery, what muscle did they repaired? Was it the supraspinalis?
Yes.
Yeah. Okay. So that's basically, they call it the abduction, right? When you lift your arm that way, right? So think about just going on that particular injury. So there is a piece of anatomy that's underneath the head of the humerus where the attachment occurred, and then the other tendon that goes back into the belly of the muscle. So there's a thing called a acromion, right? So because of that joint space, right, here is your acromion and the clavicle and the head of the humerus. So when you do any rotation, it shouldn't be compressing. So you hear about those impingement syndrome where it's basically the head of the humerus is jamming on that acromion. When you have surgery, you have scar tissue formation, and then you have something that breaks it down. So the thing is that when you go through rehab, it's going to be tough because that rotator cuff muscle, the reason why it's hard to move up is that because that surgical site is right there where that bone is at, and it nicks that thing. So when you look at those kind of things, in my world, we have post-op patients, I have to go into your armpit, and then I grab the head of the humerus and I drive it down south to get it off of that acromion, and then you're allowed to go up. So then I would do that kind of aggressive. So we get a little aggressive with our rehab. I understand.
I hear you. It's been 3 years now, so I'm good to go. I can do all the things, but
Awesome.
they break the collarbone and then they drill it into the front of your shoulder, and it's just every now and again you can always feel the screw right about there as you're doing stuff.
Yeah.
So what's the biggest misconception that people have about stem cell therapy, and how does your work challenge that?
I think the biggest misconception, that thought process of it's about live cells. So when you hear about clinics doing stem cell therapy and they're quoting 10,000 or 10 million live cells, the misconception is that there's only a few places that really harvest the cells, right? There's a couple labs here and there. And then when you're at a clinic, they'll basically ship the vials to you in a package on either some type of nitrogen or some type of container less than negative 66 degrees. When it comes to you, it's basically frozen. So there is a process that, that from this live world that go into a cryo and then back to a lab. There's a process to defrost it, and it's a very tedious process. So if you're not really aware of the process, it's like what they say is that you can just take this vial, this 1 or 2 cc, which comes in a plastic little 1 by 1 type of vial. And then they just basically tell you, all right, once you get it out, room temperature, sit it there for a little bit. And then when you're ready to do the injection, put it in your palm. And then with your body temperature, you'll have it in your hand for 5-10 minutes or whatever. And then it'll get back to its gelatinous liquid form. And then you can go ahead and continue your procedure. The problem with that is that it's called shock thaw. You're going to feel the cells. But here's the thing, it still works. So then you're moving it. Well, if it's so much about the live cells, but it's dead now, but still works. Now what you're moving into? Now you're going back to the EVs, the signals. It's about the signaling. It's what has happened to secreted out those messages. So that's why it's really important that I try to tell people, don't worry about the cells. The cells it's neat and everything, but it's about the signals, EVs, what they call the cell-free molecules that signal your existing tissue. They call it bioactive biomolecules. Those are the information that you want to signal. You want to get that young, vibrant, that signalers to go to your existing tissue to wake up. It's like that old analogy, like you have an old dog that was very active when he was young, and then he's sitting around, just basically just 7, 8 years old, just having a good old time by just laying around. You put a puppy next to him, all of a sudden that old dog wakes up and they're all acting young again. Same thing. It's just it's a signal. Hey, it's time to act young again. That's the analogy I like to use.
No, I really like that. It's good. In your book, you share Jeff's story as a case study. What makes his journey so powerful in illustrating what topical regenerative medicine can do?
Jeff's a good story in the sense that him going through the discovery of what's regenerative medicine. Number one, starts off his knee pain, where it's at, what are your options? He still wants to be active, and he's hearing about these type of like stem cells. He learns about more about what are the stem cells, what are the different kind of stem cells, what are the truth, the kind of stories, the myths, what's going on, and then what are the risk factors?
A lot of myths.
And then what are the risk factors? And then where are the features moving into? And the feature moves are moving into topical. So just things like your podcast and AI, these patients are being more informed in the sense of back in the days when my dad was around, it was the medical world and that was it, right? You just take his advice and maybe Psychopedia or something like that, but there was no other source of Google and anything you can think about in the online world, right? And then you got videos, and then we have these conversations, and it just wakes people up to see alternative approaches. So the interesting thing is that now this whole world of regenerative medicine that's slowly moving out of that injectable and in the medical world is moving it into the world of the patient. They're in command. They can say, hey, I want that. I need that. I don't have to take the advice because I want to hear all the choices and then figure out what's the best choice for me with all the information. So that's what I'm excited about. And Jeff learned that during the book. He learned about finding out what stem cell is, the process of injection, the risk factors, what's the do's and don'ts, and then finding out the topical side of it, and then the route that he wants to take, which is a non-invasive, same type of outcome, but a different delivery system. That's all it was. So that's why Jeff is moving into the future.
Now, we've talked a lot about elite athletes, but who else would this be for?
So elite athletes, perfect. Who else? Think about that 40-plus person that's active. I'm 57 years old, so I'm definitely the perfect candidate when it comes to thinking I can still do things. Yeah, you know how that mindset of I can still do things, but wait a minute, I got to be careful. So you have to know your limitation, but then you still have the ability to do things. You know that you can still do a workout, and then I wish I can work out more, right? The thought process, I want to do a double session, but I need to recover. So that's the kind of person we want to look at. 40-plus people that are active, that want that, not the lifespan, but the active lifespan extended. They want to be in the 80s still able to do a travel without that side effect of, oh, my ankles, my knees, my back. I want to still be enjoying the world. I want to still be moving around while I'm retired. So that's what this whole trend I see right now when you look at people in my age group are ready to retire. They want to fulfill their life's ambition of being active, working so many years, being physically, I should say not physically, but mentally drained in front of her desk. And now I want to be in the physical world of being young and playing pickleball, working out, traveling, and enjoying life, that's the kind of person that this is really meant for. That type of mindset that you're still young and you still can feel that energy in your body, but your body needs that little signal that to turn it back on. So that's what this is all about.
And for me, from my perspective, this is the type of technology that our age group has been looking for, because we don't want to age like our parents did. And we're recognized that we don't have to, because these new technologies are becoming available to us. And plus, everybody's more into health and fitness and taking care of themselves. And that brings me to any prerequisites to having this type of treatment. Do we focus on nutrition first, as well as exercise, physical therapy, to get people moving in the direction that you want them to go first? Or can they go ahead and move into the treatment before doing that?
Yeah, it's a good question. Chicken or the egg, right? That's how you look at it. You do what you can, you just start going. You listen to these motivational videos from either Goggins, or you got all these guys that you just start, just go, just start something, right? I always say take small bites. Don't take big bites. To go into some type of evolution overnight is going to be a huge failure. It's going to fail fast. So I look at take little pieces. Whatever you think is easy, take that. If it's the regenerative medicine world, or if it's diet, take the easy route and have micro wins. Just keep winning and then start compounding. Add more in there. So if it has to do with a prerequisite, I don't think so. I think what it is get moving, and then things will evolve. You'll start saying, hey, I'm starting. Ask yourself, can I do a 6,000 step day? Let's see if you can start that. If you can do that, I got a little ankle injury. Here's regenerative medicine to accomplish that. Now, start your diet and work on that. Start caloric intake and then start slowing that down. Then micromanage your micros, right? Start playing with that. And then think of setting goals. And I want to do this, I want to do that. And just put yourself in that world. And then when you set those goals, then you know those variables. Regenerative medicine, workouts, exercise, diet. So it's like, I always say start somewhere first, and then you'll figure out how to maneuver yourself to make that perfect scenario of that athlete to finish that goal.
Yeah, I always consider, am I being honest with myself in physically, mentally, emotionally, and spiritually? Am I being honest in all of those areas? Have I done the work that I know that I need to do daily in each of those areas? Am I putting something in each of those buckets? And is it driving the needle forward enough to have an impact in my life currently? When I start looking at all the different modalities and methods and tools that are available, I just try to focus on those small things that are right in front of me, the things that you can do daily.
Yeah, there's so many great things out there. There's so many, I feel there are, I look at the fundamentals of your body, which is you have the voluntary and then you have the involuntary or the autonomic side. And a big thing that people don't know that I wish they get more involved with is the HRV world. That heart rate variability, that is huge. That is something that's almost, it's almost like a biofeedback of how to really control your autonomic nervous system. If you can get really in control of how you can fire off your parasympathetic and your sympathetic and utilize that in an environment of work, life, children, stress, it's huge. That thing is a secret weapon about life. So like you said, there's so many modalities out there and tools that you can just enhance and just figure out how to make the most and the best of you.
No, it really is. It's difficult. It's simple, but for a lot of us, it can be difficult, right? But it leads into that gene expression. So if you can find a way to regulate your nervous system, go for a walk, take care of yourself physically, mentally, emotionally, and spiritually, exercise, read a book, right? Do some breath work and put yourself in that position where you can spend a little bit more time in your parasympathetic nervous system. You're going to notice the physical changes, the physiological that come along with that.
Yeah, going on that note of the parasympathetic, the opposite, of course, is sympathetic. So if you think about, if you have even chronic stress, repetitive stress, stress for us is good. Quick stress and then turn on your sympathetic and then turn on the parasympathetic. And that's what you want. You want those HRBs that are wavelength that go fluctuate back and forth. So you have sympathetic, parasympathetic. So you want that. You just want the ability to have that on-off scenario of those two machines. The problem is that when sympathetic is chronically on, turns on and stays on. Now you think about what sympathetic does. It basically increases heart rate. It shunts the blood from your extremities to the core, and it gives you almost
cortisol.
Yeah, so you're in heightened awareness, but for a long period of time. Now, because of the decreased circulation in your extremities, you're prone to injuries. So it goes all hand in hand. If you feel that you're in a stressful situation for a long period of time and you start getting injured a lot, don't think about because it's an injury onset. Think about the really primary thing, stress. Stress decreases the circulation of the extremities where you're basically prone to injuries. So you've got to control that. So again, HRV, learning breathing exercises, and understanding that when you exhale is a parasympathetic, inhale is a sympathetic. So I always say do the ratio more exhale in seconds than inhale. So a 4 to 5, 4 seconds inhale, 5 seconds exhale. So you command more of the parasympathetic. So there's a whole, and you can play with it. There's devices out there that can watch your HRV as you breathe. So you can see as you decrease or you exhale, you can see HRV get manipulated. So it's a fun game out there.
Yeah, you can gamify your wellness, that's for sure.
Yeah.
And who hasn't sneezed and thrown their back out?
Hey, I'm at a point where I have to get into a squat position, lean sideways, and I know the right, like the athletic position to take that sneeze.
Yeah, I know the weak spot. It's right about here.
If we all got one of those.
Yeah. This is a good one. So if a listener picks up your book, what do you hope they walk away understanding that they didn't know before?
I would love for the reader to take away that the future is a non-invasive and in your hands. It's just educating the patient. It's almost like I'm in practice right now, and I like talking to people and educating them about their injuries, anatomy, biomechanics, and just telling them this is why it happened and go into a little more depth. I wish I had more time with them because it's almost like if you can educate the person, they can figure things out themselves. They know how to gather information and pull it together. So from the book, I want to just make sure that they understand that there are information out there that you can get in your hands to help you along. And that book should be one of those piece ingredients that helps them along in their recovery or their future endeavors or a possible like a prehab world.
So regenerative medicine is a field of both hype and hope. What do you want people to truly know about where the science is at today?
The science is still moving forward. The science is still in research and trials. So we're always learning. There's no doubt about we're always learning. But there are simple principles in there that understand about just biology. So chromosomes and learning about what happens when you go through mitosis. And then from there, finding out, will that particular DNA from the donor site turn into your DNA? Logically speaking, impossible. So then what's the next logical thing? It's got a signal. That's where the science is going to move into, is a signaling. The big buzzword right now is called exosomes, right? You heard of exosomes out there. So that's a signaling molecule. It's basically just a vehicle to put information in this little molecule, and then it goes into your body and it goes next to a cell, and it goes to this thing called a paracrine, and it signals their existing tissue to do something. So that's where the evolution, it's about the signaling from either damaged tissue. Think about what we go through with signaling. There are hormones out there that signals your organs to do something. There's always something to signal. So this is just a different signal that has a different information that's more vibrant. So that's the regenerative world that's going to move into.
And where do you see regen in the next 5 years? Is it ever going to be on the shelves where people can get it for themselves?
Regen, the product, is the tough thing with regen is it's hard to get it on the shelf because there's human tissue on that thing. So it has to come from either a doctor of chiropractic, any provider, acupuncturist, physical therapist, but it has to go in that route because it's got its professional use only where it can't go directly to the consumer. So in 5 years, I believe that this is going to be in the hands of many chiropractors, providers that provides it to their patients.
And what is the shelf life on a product like that?
The shelf life on that is 6 months in room temperature or 1 year in refrigeration.
Oh, that's really good. From my perspective, anyway. That might not be good from your perspective. You might want it to last a lot longer than that.
The good thing about it is when we source our tissue, we give the lab a heads up, so then the clock starts then, and then we get our orders. We predict what that's going to happen that month, and we push forward from that point on.
And is that sourced from within the U.S. or outside?
Yes. Yeah.
Awesome. Dr. Tommy Rhee, thank you for being on the Blueprint Podcast. Tell everybody how to reach you and how to get your book.
You can reach me at, if you have any questions, you can email me at info@regen.com. That's RHEEGEN.com. You can get my book on Amazon. It's just Google my name, Amazon, my name, Dr. Rhee, and in the future of regenerative medicine. And you can get that book right there. And then you can go on my website too and then learn about that topical stem cell cream, which is Regen. So it's Regen, RHEEGEN.com.
And of course, all this will be in the show notes, guys. And it sounds like you're going to have some social media up and running soon as well.
Yeah. We're changing things around. So I apologize if you go on the website and you see a little bit of down or work in the construction. So change things around. You can go on the social media. I think I apologize, but it's like Dove Regen, Instagram, and I don't have a TikTok. I got Facebook. So this is all new to me for a 57-year-old guy. I just thought about Wi-Fi.
And is there one question that I didn't ask you that you wish that I would have?
No. I think that the big thing is just making people aware of regenerative medicine, and there's information out there. Don't just take my information. Just go out there and look out there and then question about that information and then continue on your research. There's a lot of sources out there. And then don't only listen to me, question me and do research on me. Figure out is he telling the story. I love the internet. I love the fact of you can check and recheck and just really check on facts.
Yeah, we talk about this a lot. Healthy skepticism is a good thing, and honing that skill of discernment, especially in today's day and age with AI, is hugely important.
Yeah. Love it.
Dr. Tommy Rhee, thank you.
Thank you very much. I really appreciate it, Jason.